Disclaimer: this video is made solely for the purpose of learning. The facts and information used are authentic. The recording of the patient has been taken at his consent, and viewers are requested not to misuse the same.
History. A 77-year-old man has been visiting the Chanakya Physiotherapy Center, Bhuj, since the last 3 months in regards of his constant tremors and slight instability, which makes performing daily tasks tough. The patient has an 8-year-old history of Parkinson's disease. The cause was a mental trauma. Since then he has been taking medications and relying on physiotherapy. There is no family history of Parkinson's disease. He has 3 healthy and unaffected kids.
Physiological diagnosis. System involved is nervous system, and the functional loss is due to lack of dopamine in the brain due to degeneration of substantia nigra, the cells that produce dopamine. Investigation. There is no particular test for Parkinson's disease like a blood test. Hence, investigation is solely based on history taking and physical examination.
Clinical diagnosis. The patient is suffering from Parkinson's disease. What is Parkinson's? Parkinson's disease, also called as paralysis agitans or shaking palsy, was first described by James Parkinson in 1817. Parkinson's disease is a neurodegenerative disorder which leads to progressive deterioration of motor function due to loss of dopamine-producing brain cells. Most of the movement-related symptoms of Parkinson's disease are caused by a lack of dopamine due to the loss of dopamine-producing cells in substantia nigra. When the amount of dopamine is too low, communication between the substantia nigra and corpus striatum becomes ineffective, and due to which movement becomes impaired. In addition, abnormal clumps called Lewy bodies, which contain the protein alpha-synuclein, are found in many brain cells of individuals. The function of these clumps in regards to Parkinson's disease is not understood. Factors causing Parkinson's disease. There has been a lot of research into it, but so far, doctors still aren't sure of the exact cause of Parkinson's disease. Though some of the risk factors are known, like genetics, it play only 10 to 15% role in Parkinson's. Gender. Male are more often affected by the ratio 3:2. Also, pesticide exposure can also be an environmental factor leading to Parkinson's disease. And finally, like in the case of our patient, head injury or trauma may also lead to Parkinson's disease. Thus, based on this information, we conclude that our subject has stage 2 Parkinson's disease. Now, we will discuss the symptoms of Parkinson's disease. The symptoms can be basically divided into 2 categories, motor and non-motor symptoms. Now, first we will discuss the motor symptoms. This can be remembered as the mnemonics Parkinson's trap. In the Parkinson's trap,
The T stands for tremor, the R stands for rigidity, the A stands for akinesia, and the P stands for postural instability.
Here, T stands for tremor, and in Parkinson's, the tremor is of resting type. As we can see in our subject, even when he is sitting idle, his hands are showing tremor-like movements, which resembles the action of rolling pill between thumb and index finger. Hence, it is also called as pill rolling tremor, which decreases when he performs certain actions.
Now coming on to rigidity. Rigidity is involuntary increase in muscle tone present throughout the range of movement. Rigidity is basically of two types, the lead pipe rigidity and the cogwheel rigidity. Cogwheel rigidity is a type of rigidity in which passive movements of the limbs elicits ratchet-like start and stop movements through the range of motion of a joint.
Bradykinesia, which refers to slow movements, hyperkinesia, which refers to lessened movement, and akinesia, which refers to absence of movements. So in our subject, we can see bradykinesia and hyperkinesia, but no akinesia.
Postural instability. Postural instability is a disturbance in balance that impairs the ability to maintain an upright posture when standing and walking.
So, we can say our subject is able to walk forwards on his own, but when it comes to turning and walking backwards, he experiences instability. Also, he doesn't experience any falls. Non-motor symptoms of Parkinson's include anxiety, respiratory difficulties, loss of smell, cognitive changes, depression, hallucinations, sleep disorders, speech and swallowing problems, urinary incontinence, and vision changes. Our subject experiences a mild to moderate level of respiratory difficulty in the form of shortness of breath after some physical exertion. Also, our subject didn't experience any hallucinations or depression. Instead, we have seen a very positive attitude of our subject towards life. He also experienced no trouble while sleeping, but he experiences a certain level of difficulty in speech.
As mentioned earlier, Parkinson's is not a totally curable disease. That is, no one can be completely free of Parkinson's once they have been diagnosed by it. But the symptoms of the Parkinson's disease can be kept under control to live a long and healthy life. Hence, the treatments focus not only to stop neurodegeneration, but actually to increase the dopamine signaling. Now, the type of treatment basically falls upon three major categories: treatment by prescription medications, treatment by surgery, and treatment by physiotherapy. Our patient opted for treatment by prescription medication and physiotherapy. The prescribed medications are carbidopa-levodopa, the first-line drug for management, dopamine agonists, drugs that mimic dopamine, MAOB inhibitors, drugs that prevent breakdown of brain dopamine, COMT inhibitors, they mildly prolong the effects of levodopa, anticholinergics, drugs that help to control the tremors, and amantadine, an antiviral drug that increases dopamine production. Our patient used carbidopa-levodopa, the most widely used and also the most effective drug for Parkinson's. Let's learn about the mechanism of carbidopa-levodopa, the magic drug, real quick. Now, in Parkinson's, we know the major cause is the lack of dopamine. The question is, why can't the peripheral dopamine just be transported into the brain? Well, the problem is the dopamine cannot cross the blood-brain barrier. But its precursor levodopa can cross the blood-brain barrier to reach the brain and get converted into dopamine by dopa decarboxylase. This is why levodopa is used. Now let's see where carbidopa comes into action. There is also peripheral dopa decarboxylase present, which can convert the peripheral levodopa into dopamine before it crosses the blood-brain barrier, which is not what we want. And hence carbidopa is used, which is an inhibitor of peripheral dopa decarboxylase. This is the reason why a combination of both levodopa and carbidopa is used to treat Parkinson's.
Physiotherapy. Physiotherapy is a vital component of the long-term management of Parkinson's disease. National clinical guidelines recommend that physiotherapy to be incorporated into any multidisciplinary management plan for Parkinson's disease. Physiotherapy focuses on mobilizing joints that have become stiff to help regain normal movements, particularly in the trunk.
Next, you'll see a set of videos of our subject performing his routine physiotherapeutic exercises. First, he performs some exercises that focus on improving his fine motor skills, such as holding or grabbing objects. Next, he performs some actions or rather exercises that focus on improving his gross motor activities, that is, doing the bigger things like moving around his limbs, walking, etc. Now, though our patient has not opted for any surgical treatments, we'll talk in brief about a very interesting treatment called deep brain stimulation, which is very effective and whose effects can last for as long as 5 years. In DBS, electrodes are inserted into a targeted area of the brain that directly sends signals to basal ganglia that counteracts aberrant signaling seen in Parkinson's. Following is a video of a patient having Parkinson's disease. where we can appreciate the improvement that takes place after deep brain stimulation.
Like without the medicine and the stimulator. And now we're just going to turn it on. If I can get my fat fingers to hit the button, there we go. See how that feels. How you feel?
As our professors have taught us, learning should always be focused on research. So, we thought before ending, we should include a few recent interesting research findings on Parkinson's disease to stay updated. The first is lipid accumulation in the brain may be an early sign of Parkinson's disease. It was found by McLean Hospital on April 29, 2018. In this, researchers have found that elevated levels of certain type of lipids in the brain may be an early sign of Parkinson's disease. This finding could have significant implications for identifying patients who may be at risk for developing Parkinson's disease and for the early treatment of the disease. The second is rabies. Rabies trick could help to treat Parkinson's disease. It was discovered by American Chemical Society on April 25, 2018. In this, the rabies virus wreaks havoc on the brain, triggering psychosis and death. To get where it needs to go, the virus must first trick the nervous system and cross the blood-brain barrier, a process that makes it of interest in drug design. Now, scientists report a way to exploit the rabies virus machinery to deliver a Parkinson's disease medication directly to the brain.